Hello and welcome to the show Beyond the Journal, where we discuss social media, digital education, and current controversies and issues in cancer and medicine in general. I'm Dr. Jack West, Associate Professor in Medical Oncology at the City of Hope Cancer Center in the Los Angeles area. I'm happy to be joined again by my co-host, Dr. Charu Aggarwal, who is the Leslie M. Heisler Associate Professor of Lung Cancer Excellence at University of Pennsylvania's Abramson Cancer Center in Philadelphia. Hi, Charu.
Hi, Jack. And today we are pleased to welcome to the show friend and colleague, Dr. Jyoti Patel, who's the Associate Vice Chair for Clinical Research in the Department of Medicine. She's a professor of medicine at Northwestern University and practices thoracic oncology at Lurie Cancer Center in Chicago. Welcome, Jyoti, and thank you for joining us.
Thank you for this great invitation. So good to see you both.
So I wanted to hit off by asking a little bit about, firstly, congratulating you about your new role as editor-in-chief for Cancer.net. So congratulations. And wanted to ask you, ASCO has really evolved in its efforts to educate patients. This is one of their ways to do that. And could you tell us a little bit about how this has changed over the years as social media has become much more available and patients are getting more engaged? And where do you see this in the next 3 years during your tenure?
Thank you so much. So Cancer.net is really ASCO's effort at patient-facing material, right? And I think the reason that it has grown so much over the past decade is truly it's the oncologist's voice. And so ASCO is such a broad, multidisciplinary organization, but it really has a healthcare worker's voice in providing information that's up to date, timely, compassionate and truthful. And so, there's certainly been a big effort for a long time because there are multiple platforms in which people are getting information. But this one I think is unique because it is vetted. Many of us remember Cancer.net as pamphlets that we saw in clinic or that we distribute to patients. But clearly now with how information is shared and the rise of public information and internet information, our platform has changed considerably. And so there are, I think, multiple platforms. We think about sort of evergreen information on Cancer.net. So information that is always at hand, that dives deeply into topics, different kinds of cancers, different kinds of side effects, different coping strategies. So that is information that is put together with the ASCO staff, as well as a wonderful panel of editors and experts. And both Jack and Charu, you know Cancer.net well and have served as topic experts, as well as now a panel expert. But the other piece of it now is really more looking at multimedia. So we're doing podcasts, which have really grown in the past several years. We're doing things like blogs. We're trying to keep this information really fresh and topical. I think one of the great efforts this year has been by Dr. Markham about COVID and really providing good information to patients and caregivers as it's becoming available. The scope has reached, I think, significantly because we're publishing in different languages. It's available in different ways. The mobile app has been something that we can download for a long time, in which there's sort of a patient tracker, but that's improved. And so it's really been exciting these past couple of years to see how much it's changed.
How do you keep it current? I mean, it is a good problem to have that oncology has exploded. I mean, for those of us who have been in the field, you and I have been in it for a couple of decades. And, when we started for lung cancer, paclitaxel for just about everything was going to get you pretty far. And now it's splintered, and at every meeting, the standards change, at least for subsets, and there's new treatments, new targets, and that's great, except it makes it hard to, particularly if you have a kind of big topic like managing advanced lung cancer, that's a lot to revise. So how's that work?
So that's great. So I think fundamentals are still there, right? So we have pathology and approach to diagnosis, but then therapeutics have changed so much. And so that's really one of the pieces in which we have a great ASCO staff. But as all of us who volunteer for ASCO know, that we are always willing to help, right? It's so fun working with ASCO. And so the volunteers that, the physicians, social workers, APNs, APPs, pharmacists that are on the panels really come to the editorial staff with topic updates. There's always sort of skimming of big meetings, of data downloads, and we tweak. And that's, again, the joy of digital media, is that you can tweak it in real time, right? Rather than the folders that we used to give to people. And so it's always fresh. And to me, pretty up to date.
Yeah.
Yeah, I think one of the main features is that you're getting so much engagement. But have you witnessed that patients are providing real-time feedback, and how is that managed at such a large scale, I guess?
So there certainly is. So we've had a couple of ways to get patient feedback. And so we've certainly looked at our platform, and we've done focus groups to sort of tweak to accessibility. We have an intake nurse that also listens to patients, right? So is available for for talking about particular issues. And then we ask for feedback after a patient has used, or a caregiver has used the site. And so that has certainly tweaked, I think, content, right? So that helps us. So one of the big efforts we've made right now is misinformation. Certainly, I think patients and caregivers are struggling with, how do I, again, there's something new on Twitter or on the internet every day, and how do I really find out if it's real? And so tips on how to look at digital misinformation as well.
Do you track, I imagine you do, but what are you seeing for how people want to consume their content in terms of text-based on a digital platform? How are people downloading PDFs? Do you have a sense of people doing that and then having a pile of those PDFs available to actually hand as paper still to patients in the clinic? Is there an ever growing interest in an audience for video content, and is there some sweet spot for the size of these things? Do people like a really concise modular approach, or a whole chapter about their topic?
I think those are great points. So I do think one of the beauties of cancer.net is that it is so broad. So there is that sort of PDF format where it is that evergreen knowledge, and understand that ASCO is a global organization. And so there are places in which this is really the only source for some information. And so we have reprints in Spanish and Mandarin. And so around the world, there are many people that are using the PDFs as their patient.
That's awesome. That's really cool.
Right. And we're trying to increase the number of translations. We're trying to, again, it's still about half of our traffic is global, is international, is ex-US. And so how that information is delivered is probably a little bit different. So in addition to that sort of evergreen piece in which it's very much about patient education about a particular cancer, side effects from the therapy, there's also that huge piece that's caregiving content. There is sort of the psychosocial, some of the other questions that, again, sort of beyond the exam room, right? The things that happen at home. And I think that information, it tends to be more topical. So it's really well suited for some of the podcasts and the blogs. Many of those, we're now, again, sort of really looking at how do we talk about participation in clinical trials in a much more sort of personalized way. And so one of the efforts that the GU panel has done has been doing updates or roundups from meetings about clinical trials in progress, and really explaining the rationale for a large phase 3 trial. Why would we even want to know? And hopefully piquing interest in patients for volunteering for clinical trials.
That's excellent. And for our listeners, cancer.net is available as a resource for patients. I actively tell my patients to visit the website as they're, coming to a new diagnosis, as well as find provider resources. So just a shout out, and please reach out to Dr. Patel in case of questions. And of course, there's lots of opportunities to volunteer. I'd like to change tracks a little bit here, and wanted to touch base with you about ASCO's media efforts over time. Messaging has changed. The world has changed. The pandemic has changed in terms of how we absorb information. You've been involved with ASCO for a very long time. And, what do you think is the wave of the future? Are we going to be really relying on updates from Twitter? And is ASCO going to make more of a presence on social media as compared to, what they did in 2010, for example?
It's a great question. So certainly I served as ASCO's communication chair, sort of when Twitter was just starting and when we were really focusing on voices of ASCO. Things have evolved considerably. So we don't, as you allude to, wait to a data download once a year now, right? So our trials are faster than ever. We get updates, there are multiple meetings, and data is much more democratic than it ever was. Before, it was like crowding into a room. Were you there? Did you see it? And now it's in real time around the world. And so certainly I think ASCO and Cancer.net and other organizations really have to change with the times. And I think they have. The efforts at having like the plenary series, I think Dr. Johnson is sort of heading some of those efforts this year in cooperation with Dr. Vokes. This idea that we need to stay sort of topical. ASCO remains the most trusted voice in cancer care in the world. And so it's important that ASCO owns some of this and provides context and experts to really understand how these innovations play into practice. My sense is that that this democratization of information, right, is going to be a real challenge for in-person meetings, because everything that someone presents at the same, all of the things happen at once. The embargo's lifted on the electronic publication in New England Journal. Someone's tweeting about it and sharing slides immediately. Someone's at home watching the virtual meeting and commenting to a much wider audience. That's great. It's certainly exciting, I think, for a general oncologist, for someone who may have really wide scope. It's got to be like drinking from a fire hose every single day.
Well, I was just going to say, I think that the explosion of just how information gets distributed that it coincided with the pandemic, and ASCO annual meeting was over 40,000 people walking a mile and a half from one end of McCormick to the other. I mean, there's practical challenges to it. It is dizzying and, intoxicating in some ways, but not the easiest to navigate just practically. And as you say, I mean, just you can't be in everything you want to be at. And virtual has its own issues, but it is a way for at least people from far away from Chicago, often, other parts of the world, to participate without having to take days and days to get there, thousands of dollars that may not be readily available. So I think that democratization is really interesting. But the monthly plenary series, I think, is very in keeping with kind of where we need to be now, but it's going to fundamentally change how we consume everything. It's not going to be some huge meal and event, in late May, early June that is a giant bolus, but rather, the content gets distributed all year round. And I think we're probably not going to be seeing, both for the pandemic and the role of virtual, even independent of the pandemic, 40,000 people in the same place anymore.
I think that, right, it's fundamentally changed. I don't think we'll ever get to those numbers, but I still, and again, maybe, I'm dating myself a little bit with this, but certainly I've been in auditoriums with you, Jack, over the years where there is that sort of moment of awe and that feeling that I am something greater, right? Like, think about like the cervical screening in India, when that plenary session was presented and you saw such a reduction in mortality. It was really humbling. And that collective sort of piece was one that was so inspiring. And so I'm going to miss it, because I feel like now my, I get excited certainly about data, but I think maybe my sort of, I've certainly narrowed my emotional lability, I guess, when I see something.
And I think what I miss most is getting this off the cuff, fresh, hot off the press. You see the data, you walk out of the auditorium with your friends and colleagues and, asking them, what did you think? And, having these ongoing conversations, which are not staged or which are not planned. I really miss that interaction. And I feel like we're going to not be able to create a way to have those conversations with the monthly series. And I do think that the discussions in real time, like the discussant talks in real time, in a are sometimes better consumed, because you're sitting with your colleague and you're saying, hey, I didn't even think about that. And I just think the discussant talks, I just miss the vibe of being in a live discussion talk when I'm just listening to it online. I feel like there's just so much justice that a well thought out discussion does, and just the content that's generated around it is something I really miss.
The last piece I would just say, and again, for me in particular, it's hard. Like, our lives are really, really full. And when you don't leave and sort of give your whole mind space to something, you wonder, like, how much am I multitasking? We're watching meetings at the end of clinic, and that sort of the patient responsibilities are on us. You're hiding in your own house, hoping that your family won't find you and ask you what's for dinner. Like, it becomes much more complicated, and you don't necessarily have that time to reflect, I think, the way we used to.
Yeah,
absolutely. And I think Jack and I have discussed this previously, when is the right time to do virtual meetings? Is it the weekend? Is it the weekday? Is it 3 days? Is it 6 days? I think people are just figuring it out, but there's a lot of meeting fatigue. I mean, we just at the heels of ESMO, and just before that was World Lung, and there's ASCO Quality Symposium. There's just so many meetings, and we just have to figure out how best to integrate them. To your point, Jyoti, I think earlier we could catch up on some. We used to have downtime either on the plane or at the airport, or just some mind space, and I feel like that's just missing at this point in time.
I wanted to ask about. ASCO, you've done a lot on ASCO's media efforts, and I would say that over the last decade or so, how we distribute content has changed in a lot of ways. And we already alluded to, text versus video, but I know that at least what you historically had been doing with ASCO, and ASCO in general has been doing, is working through conduits of mass media. Is that still your perception of how ASCO is working, or is it more direct to through social media to docs and particularly to patients? I mean, how does ASCO now perceive its audience, or how it interacts with the broader public?
So I think those are great points. So certainly I think cancer.net has always been focused directly with patients. So that's an easy carve out. But the communication efforts have I think, changed. One is through specialization of conferences as well as specialization of journals, right? So it used to be just JCO, and now there are a plethora of ASCO journals. And so I think subsets of populations have come out just from those journals in which it's direct to physicians. Cancer is hot news, right? It's even for people who aren't medical or who aren't directly involved in oncologic care, everyone cares about cancer. And so really making the message matter to the general public, to really, the rest of our stakeholders and constituency is important. And I don't think we'll ever cut the middleman, which is, again, a journalist that can put in context for their particular readership. So will there be a reader? There's certainly the trade journals, which will continue to exist, but then the ability to really have access to reporters from the Wall Street Journal, from the New York Times, from Good Housekeeping, right? I think that ASCO will continue to really grow in that arena. Sorry.
I'm sorry. I was just going to ask, I don't, Charu and I spend a good amount of time on Twitter, and I don't think you personally do that, at least as a personal account. And so I just was interested in, your thoughts of, maybe it's just not your preferred platform and you're on Facebook or other things, or you're just overcommitted in other ways. But I mean, what's your kind of personal philosophy or approach, strategy to how you use or don't use social media in your professional life and otherwise?
Right. So certainly in my personal life, I don't use social media. So not on Facebook. I have my Twitter handle is J Patel MD, and maybe once a month I'll post, maybe. But I certainly follow you. So I read, so it is, again, a great information piece for me. So certainly during these meetings, in particular, in ESMO, World Lung, it was certainly great to get information. And I think during this entire pandemic, my use of Twitter, at least seeing what's happening, has increased substantially. I would like to use it more. My sense is I'd like to use it a lot. But I also think that it can take a lot of time. And so there's a lot of other work at hand in my life. And that distraction is constantly there. It weighs on you, right? I mean, you're doing and it pops up and you're like, wait, I just need to focus on this other thing. And so I think if I had unlimited time, I'd probably do more. But, just in terms of prioritization, for me at this juncture is probably not so much there. My teenage boys have helped me a little bit. They're like, Mom, I was like, so on Insta, you do this? And they're like, don't call it Insta,
Mom. Apparently, there are two versions of Instagram, fake and real. I don't know if they told you that.
Insta, yeah. I heard about it. Snapchat, heard about that.
So, Jyoti, you recently came back to Northwestern. You were at University of Chicago for a little bit. I think many of our listeners and, both Jack and I have also thought about this in terms of, when do you decide to stay or change institutions? We recently had Mikhail Sakaras join us for our podcast. And, he described his process like he took out a map and, he and his wife thought about which place they wanted to move to, and they're getting sick of the cold and decided to move down south to Miami. Some of us don't have really the luxury to be able to just pick up the map and say, I'm going to move. I mean, personally, for me, I think it's going to be really hard to move because, my husband is established here, kids are in school, and it would take a lot. And I just wonder, what were some of the conversations in your head in terms of, moving cities versus staying in the city, and how do you decide to change institutions?
Sure. So, it's tough. My husband is a surgeon. And when we decided to move to Chicago, both of us in sort of our initial job search, almost 20 years ago now, we're very much focused on, okay, where can we be happy, and sort of thought about towns that we could live in, and then started looking at institutions. For other people, it goes the other way, but certainly we had been together and apart between New York and Baltimore and Germany, in all of our fellowship training, and then back to Chicago. So we had sort of made some sacrifices for 3 years, and living together and not living together after we were married. And then when we decided to come back to Chicago, we were both really excited about opportunity, but things changed, right? So the first time I was at Northwestern, I was there for 15 years, really building a lung cancer program, and felt that, I was really proud of the program I had built and felt like I was accomplishing a lot, but I was wondering if I was getting stale, and sort of this idea of, okay, what else can I accomplish in this institution at this time? And certainly a supportive institution, it should be limitless, but sometimes you just wonder, what else is out there. And a lot of smart people told me that the grass isn't greener in other places. They just use different manure. But certainly at the time when someone, is talking to you about a different place, this idea of sort of rebranding and resetting yourself in many ways is really exciting. And so then when I had the opportunity to think about University of Chicago, and Walt Stadler and Everett Vokes were just wonderful, it really, to me, was an idea to have some personal growth. And I think that was really the piece. It wasn't so much how much more can I do, but how can I learn about new challenges and really sort of push myself in new ways. I certainly looked outside, would get inquiries to leave Chicago for a long time, for years. And because of sort of 3 kids and a dual career marriage, it was not certainly impossible. It was doable. My husband and I have, I think, a really supportive relationship in terms of, so it's something really important to someone, we'd make the sacrifice. But there were so many other good things in our lives. We love our friend base. We love really our life here in Chicago, and sort of leaving that would have been really difficult. And so we made this decision, certainly as the kids were in high school, that this was home for us. Going to U of C was wonderful. Again, like just great people, great opportunities to grow. And I learned so much. And then, and then you start thinking like, okay, you're 50, what happens next? What does that next mountain look like? And so really deep conversations about what was important to me and what my career trajectory would look like. And so one of the big things was really can I have a bigger role in terms of mentoring and really helping faculty sort of find their passion? How can I be the rainmaker? And then that position became available at Northwestern, and Doug Vaughn, the chairman of medicine, asked me to come back as associate chair for research within DOM, and a couple of cancer center roles as well. And so it's been a really exciting year and a half. Despite the pandemic, I feel like we've been able to put together programs that are not just cancer focused, but across the boards. I'm working with cardiology, with GI, with ID, in really mentoring and helping the junior faculty to figure out, sort of find their passion in many ways. And that has been my passion, I guess. So it's been good. Certainly, I'm lucky. It's nice having 2 NCI cancer centers in one city. And so everything, your home, my life stayed the same, but I felt like I changed institutions and my work life changed significantly. So that made it a little bit easier. But certainly, it's been funny. I was gone at University of Chicago for about 3.5 years. And sometimes I'd see people at Northwestern, they're like, "Have you been on vacation?" I was like, "No, I left the institution." They're like, "Oh, okay." So
That's really funny. And I know Jack has had some of these, sort of introspections as well. I think, Jyoti, you outlined it very well that, at a time you just have to ask yourself what's most important. Is it leaving the city, or is it really staying in the city and then rediscovering what your passion is? And Jack, I wonder if you want to talk about your own personal transitions a little bit. I know on our podcast, we don't really touch on our own, but I think this is something that's near and dear to your heart as well in terms of transitions.
Well, I think that Jyoti outlined some of the same things that I was thinking about. You reach a point kind of mid-career where you can see the trajectory of what could be the rest of your career and think, what do I still want to do that I haven't done already? And I think that is a motivation. I think it's always challenging to move. For me, I'm doing more now telemedicine, work from home based stuff because I have a fair amount of administrative role and trying to build up telemedicine. And that has given me the freedom to work in different places. My kids are still based in the Pacific Northwest. And so when I moved to City of Hope in Southern California, it wasn't an unpleasant move, particularly around the winter time, but I miss seeing my kids. So being able to work from any place has its advantages, at least a lot of the time, to be able to work from various places. But one thing I wonder about, Jyoti, and you've lived it, but your role in mentorship, both through ASCO and all the people you meet and at your own institution, what do you say about the general concept you've got to move up? I think that there is a tendency, even at supportive institutions, to be seen as a bit of the furniture, particularly if you trained in a place or have been there a long time, to be a bit taken for granted. I think I certainly hear from a lot of my female colleagues that they may feel that they've been kind of relegated to a lower gear because of other priorities that I think many of us have, but women are often undertaking more of. I don't know if that enters it all in when you have a mentee. Do you think that it's potentially advisable to sound out all the other opportunities to know your worth, and even at least have the an opportunity in hand, maybe to strengthen or clarify what your own institution feels about you? Because I do think that chestnut of you got to move up is pretty common. And I strongly suspect that when you went from Northwestern to University of Chicago and back to Northwestern, it wasn't all a lateral move for you.
I think that's a great point. It was certainly a huge return on investment, right? Like it paid off in spades. And often, I think I'll say some sort of general things. I think women are often, nervous about being sort of the squeaky wheel, right? You can easily get a reputation for being a complainer if you're like, wait, how much do you value me? Is my salary the same? Am I getting the same support? And so often people will say, okay, I'm not going to do that. But I would push back and say you absolutely have to engage in those conversations and hold people accountable. Certainly, I think finding out what's happening at other institutions. And so, meeting people, understanding what you'd be worth in many ways at a different institution gives you that information to really have good, productive conversations about it. So often, I think administration thinks women won't leave, right? For all of the reasons outlined. My family's here, my husband's here. And so, in dual couples, I would say, right? So anyone who sort of got their anchor because of a dual career. But as we know, things change. And so that piece of me actually saying, I want to see what else is happening was really impactful. And I would say my stock went up significantly just with that move. They were like, oh, she is a leader and she's willing to act on it. So I'd encourage people to have those conversations. So often we live in a little bit of an echo chamber. I'm getting through my work. I'm doing my commitments. And the people around me are happy. But it's really important, I think, to do a scan of what's happening in your region and around the country to get a sense of really whether you are being treated not just fairly, but be treated well, right? I mean, it's hard work.
Well, I mean, you've got to, I think, assess your opportunity costs of the things that you're not doing. I think if you're not looking outside the walls of your institution, you don't necessarily know your value, and you need to weigh staying versus leaving. Not to say that it's good to, have the turnstile of rotating through different places all the time, and you don't want to uproot too early, but at the same time, you don't want to, as institutions can change as well with mergers and just the whole leadership may change. You don't want to necessarily be a frog in boiling water and be too complacent. I think it's a fair struggle. You don't want to be a complainer, but at the same time, you don't want to take less than you're worth somewhere else.
Right.
Yeah. And I think it goes back to introspection in terms of what you really want, which can help you, I think, decide between reaching out to too many opportunities versus keeping it very focused in terms of what, evaluating, is this really something that could be a potential next opportunity? I often find that people look and, cast a wide net because they're just looking, but sometimes it can be misdirected because then it comes across as, well, you don't really know what you want to do. So I really take that point, Jyoti, of what you said, of really asking yourself what's important, what your goals are.
Can I just ask both of you, you're both in dual medical career families. And Jyoti, you already mentioned that it's certainly advantageous to have two NCI designated leading cancer centers in your city. I know you grew up in Terre Haute and you didn't rush back to, I think the opportunities would be more limited there. But you are in a place where there are plenty of good institutions to think about. And you can do that in New York or LA or someplace, and Philadelphia as well. So Charu, I don't know if for both of you, was that ever part of the thought process of where you land that, if it's not forever at my institution, there are other good places where I am that wouldn't necessarily uproot our lives and families? I don't know how common or easy that is, or if you were looking back, to that original decision, you would tell people, you might want to think about making sure that you have a few options close to home.
So I would say absolutely. I mean, certainly it's part of that sounds horrible in many ways, but that's part of the framework. I knew I wanted to live in a more urban place, right? We like the city, but this idea that it was from the beginning, my husband and I worked at different hospitals. Understanding the full medical system in a location or in a region, I think, is important. And it is nice to know that there are a lot of opportunities. It's certainly, recruiting dual couples, as we know now, on sort of the other side of it, it's hard to get. Oh, there's a rheumatology space and a surgical oncology space. That can be a little bit tough.
Absolutely. And I would say that as a dual career family, but also as a dual oncologist family, this was a very intentional decision to be in a place where we both had options and space to grow, and recognizing that we're not going to really have the leverage to just pick up and leave every few years because we have two careers. And, at one point we were thinking of both going into academic oncology, and oh boy, I'm so glad we dodged that bullet because managing two academic oncology careers would have been much, much, much more, I think, strenuous than it is to just manage two oncology careers. But I think, Jack and Jyoti, you have to be intentional in terms of, if you, especially as a dual career MD family.
Can I ask, as a bit of a turn, we've alluded to some of the changes that the pandemic hath wrought in education, meetings, and work from home. I'm sure that Northwestern had to adapt, like every other institution, to doing more telemedicine starting in spring of 2020, and that's probably kind of petered out somewhat, at least, if not very largely. Can I get your sense of what you personally thought, or what you hear from colleagues in your leadership role there? Was this something that was acceptable to pull out, in an emergency, but can't wait to put back and just relegate to emergency use only? Or is this something that you heard that there are many patients who really value not having the traffic and is it well suited for stable, longer term follow-up people and going to be kind of used longitudinally, generally at your institution and in your clinic personally?
I think that's a great I think we're faced with a hybrid, probably, right? Like virtual meetings. Certainly for many of our patients who are on active treatment, who are having symptoms, I feel it's really difficult for me to do a televisit. I don't enjoy it. I don't get a good sense of really the dynamics in the room, how functional the patient is. I feel like I give perhaps imperfect, well, not perfect. I wasn't given perfect care, but subpar care for what I'd like to deliver. For patients who are on long-term follow-up, in which there's a scan review, or patients who've had a CT scan as surveillance, actually, I think you're absolutely right. Telemedicine is so well suited for those patients. And they can come in if there's an abnormality. One of the issues, sort of a personal piece. So like in clinic, I had 2 full days of clinic this week, and I had 2 televisit patients. So most of the patients were on treatment or symptoms, and we usually do scans and MD visit the same day. So they're downtown on campus anyway. I think one of the issues that's been exciting but also tough is using televisits for clinical trials, and how FDA guidance has changed. We've been able to do telephone visits for day 8 tox checks and for blood locally. But doing telephone visits for trial initiation, so for patients who may be living in a state or 2 away, it's a challenge. Like it's great that we get to talk about drugs to see if someone's interested, but it's also really hard to assess how interested that patient is, right? Or do they fully understand the burden of having to come maybe for visits and what that entails for their family? And so it's made it more complicated. Certainly I think there are times for it, but we get a lot of requests to sort of screen a patient for a clinical trial now. And it's almost like that sort of workload is almost staggering right now, because everyone wants to talk about a trial, and it's not clear whether or not they'll be able to do it, really.
Well, Jyoti,
that's kind of that, though.
Well, Jyoti, I think telemedicine is here to stay, and many of us love it, and some of us not so much. So I think I'm sort of in your camp, and I think it's great for some reasons, but not so great for others, as you pointed out. Thank you so much for joining us today. You can find us on iTunes or wherever you find your podcast content. Please subscribe, whether on your podcast service or BeaconMedIC.com, YouTube, and leave a review. Share with a friend, make a comment, and we'd love to hear from you. You can also email us at beyondthejournalshow@gmail.com. We thank Mark Lindsay and Talking Speaker for production and distribution support. Again, thank you so much, Jyoti, and we'll see everyone back in a couple of weeks with our next guest.
Great talking to you.
Thanks so much, friends. It's good to see you.